questions for our podcast. So before we start the segment, make I introduce myself. My name now Yusra Afiz Ogun. For today's segment, na me go anchor. I don't take over our mommy seats for today. So make I introduce our mommy. We know the introduction. Good afternoon.
Good afternoon, my people. My guest sit now, sit down. So make I sit down for here. They answer question. No problem. Now welcome. Now do well. So now join us again this Saturday. Last week Saturday, the program not air. Say Baba they come to us and some other technical issues. So we just say okay. This Saturday, we will answer all the questions. We will talk, say we will answer. We remain. We will not answer for during the Youth Inclusive Leadership Youth Conference. As you know, those who join our program before, my name is Mrs. Modupe Afiz Ogun. Now maybe CEO founder Modupe Afiz Ogun Foundation. For those who are just join, and are welcome, and I don't know my name now, and I don't know who I be. Now welcome.
Thank you very much. We get for our inside house today. We get Mr. Ini. Mr. Ini, good afternoon.
Good afternoon, though. I know say for people who don't join us since they know say this one usual suspects. But we always the house. My people are greet on us specially, and I welcome to another wonderful episode on top this Ability Inside Disability podcast. For people who just join for the first time, my name na Ini Sam, and I be special educator and autism specialist. I know few way to make one rap with to carry on today.
Now, thank you very much. I say now specialists and experienced people with inside this program today. So before I start, I say make I do quick thank you to the people who join us for the Inclusive Youth Leadership Conference. You are well done, because of now we get questions we want to answer today, and many of these questions, as I go through them yesterday, the questions they are very important. Make me answer them and make we address them. So today when I get time, no time, we get time. So we can relax, answer all the questions one by one. So we get 8 questions, not 9, but 8 technical questions. So make I start from the first one. The questions say, most youths and children with disabilities which cannot have disabilities which cannot be controlled. Now the question be, how do we improve their recognition in society and improve their learning skills?
That question, huh? Go here.
The question is let us see what that's how it's there.
You know, as we don't call pigeon program, my brain don't they attune to pigeon. As they call ask the question for English, I call the one that say
old timer guest. You get more power.
Yes.
Una listeners, they write for English. Look at those. I don't get Google Translate automatically.
No problem. You go take the question one more time, small. Make you feel they take her one by one as the question they come with the answer.
Okay. So the person say youth and children we get disabilities in society, they don't already do. And the question we say, how we go feel improve their recognition for society, and also how we go feel help their learning skills improve.
Oh, you don't make, you see now we ask her for pigeon.
Why you speak?
So this question I say, how we go feel improve the recognition of these people inside society, and how we take improve their learning skills. Now make us start with that recognition when you don't talk about.
Who will be the recognition now? Papa, mama, where the village.
So recognition, I say people see them. How if we improve how people they see them inside society, and now the simplest way where if you put them recognition. If you recognize person, how person go take know you, value you, see you. Abi?
Yes.
So now waiting get value.
Yes.
Now people they recognize.
Yeah.
That's true.
Now waiting people see as important. You know, say if you go events now, e get some seats wey be say they no born you make you sit down for there. You just walk inside, you know say this seat no be for you. So if you go there, they go pursue you. So you know say they don't reserve those ones for people when get higher value, where they very more recognized, like this person go put on. Now, how you go feel make people with disabilities, with these different forms of special needs, they recognize for society, not to give them skills, not to give them, you know, say once you get skill, your skill you fit convert them. In short, your skill fits, you fit put them side by side with the value a person get.
Yes.
How will they take value people based on what them fit do?
They fit do. What they fit gain what you fit gain from them.
Waiting you fit gain from them, waiting they fit do, waiting they bring to the table.
Yes, and even and how what they do for themselves.
Exactly. If person they will be say everything that they do give them, or you go they look another person may help them every now and then. You go feel agree with me say that person value you go down. You know go rate them too much. But for person when you get disability, once he get handwork, get skill, they take care of himself, get decent level of independence. You know they come beg you, you know they carry plate, they follow you. In value go increase. And at that stage now, you know go they look and say him get disability. You go they look and say him they contribute to society.
True. They see their ability.
You go they see their ability true. And then how you go fit take improve how they take learn. Plenty strategies there. And when it comes to how people with disabilities they take learn, it is different depending on the disability when the person gets and how severe that person disability take be. Now, you get within our Dr. Bako for this podcast, they always talk. Say as long as a person you get brain, that person know they useless. You get within you go fit use that brain. So for instance, make us start with children when you get maybe Down syndrome now. Pikin we get Down syndrome. If you go school, depending on the severity of the Down syndrome, if you learn academics, if you learn handwork, on top this program, we don't host person with Down syndrome before. We be saying work now say he raise poultry. He sabi take care of chicks till they grow. He go sell them, money go come inside. Now in handwork, he don't learn them over time. He be don't get support system. In short, now in mama they teach him all those things till he reach point where they say if he do them by himself. You understand? So different ways the way these people fit take learn. Now picking when you get learning disability, maybe you get dyslexia. That one, if he go regular school, every picking they go, if he become anything for this life, anything. And waiting you go just need put on ground. We say the teachers when they that school go need get specific training on how to take support picking when get learning disability. Maybe in own problem now with reading. Plenty strategies there where we help people where they struggle with reading take improve their skills. And if it come too severe, where we say, God, they don't try, you know they work. Some assistive technology devices there, where we read text give you, you go to listen to the audio. Because learning disability now, not only learning affect every other area of your life. They okay. So plenty strategies they way if you use teach people when you get disabilities how to learn. Yeah. So
thank you very much.
Don't talk where I want to I know that just as a guy in the talk just now. Now for learning disability, now make teachers get the skill to identify and to know the areas and how they could help the picking. Then we have opportunity to also train the family members. So that as soon as they do one for school, they could follow one for house. Because children will get conditions like dyslexia, dyscalculia, and dysgraphia. Continuous repetition matter for them.
Yeah.
Not only those children. Anything we would learn, if you not repeat and we go forget it.
True.
That is human nature. But the thing is, say them they need more practice. Pass people will not get those conditions and patience. Then people will get intellectual disability, will be developmental disability, because most time learning disability if you follow that developmental disability.
Exactly.
Like all those alcohol, fetal alcohol syndrome, Down syndrome, cerebral palsy. Now still the same strategy. It's just that say the first thing is say make the teachers, make they get the training.
Yeah.
Make they get the correct training. Because training day. Not be all training be training.
Yes, sir.
May they get the correct training. Then may they apply them correctly. Then they go still train families too. Because family and school now partners.
Yeah.
Now partnership now in day. Not be say the teacher not doing work, mama not doing work. Okay, 12 na not doing our work. And how 12 na go take do na work, una go dey exchange ideas, una go dey talk to each other. Una go dey, not be so una go dey fight each other. Say this one not be my work, this one. No. What you all of una want achieve? Now make this pikin life better. Because if this pikin life better, now pride to the teacher.
Yes, sir.
If you like better, now pride to the family, and solve of problem don't still solve.
Sense of relief.
Sense of relief.
Hey, don't come
So
on.
at the end of the day, only family no go fit do am, only school no go fit do am. That partnership, now we need. Then society too, family and school, they do their own. But people for outside go look the pikin say, this one, they both go put am for psychiatric clinic. This one na mad pikin. This one when they write, so I write it be like this, you know. So now that one. For us, we be society people, we will not be papa, will not be mama, will not be brother, will not be sister, will not be teacher. Maybe they think before we talk.
Yes, sir.
Not be everything we the person mind, person they talk. But now they learn how to swallow many things. Because it will save you from adding fuel to fire where don't they burn already. If you not feel help them, pray for them. If you not feel still pray for them, waka, not talk anything. Just pass.
That one go add. Okay. My people, when I don't hear the answer to this our question, make I summarize them. Mr. Ini say, for recognition, make we empower them with skills.
Yes, sir.
Make we empower them, we give them skills so that people when they look, they know they look at disability, they go to see their ability.
Exactly.
Then say for learning skills, different methods they. You say we feel use assistive aid. I mean, Mr.
Assistive, yes, sir.
Assistive aid. Then the teachers now supposed to do training, not just anyhow training, proper training that will help support these children. Then patience, plenty patience between whether now from family side, whether now from school side. These children need patience. They need practice. Nobody like much maybe say if you teach them 4 or 5 times they don't understand, but they need proper systems, and people will be say they relax with them, they don't go to fight them. Nobody say I teach you today why you know I'm tomorrow. We take 20 times, we take 15 times before they get them. So, and as society, as our mom will say, if you don't get anything nice, I beg waka pass, no say anything. Not be everything you go see where you go talk. So that make make things how people will be say they don't already get problem. So the second question we get today, this question now regarding feeding for house. So the question say, how we fit make these children feed the same way with their siblings where they house they feed. They will say how they go feed eat like normal children. So I beg you to help us answer the question.
Okay.
Yes, sir. present twice. This person will ask now, say how you fit take make children where you get special needs, make them they chop the same thing where their siblings, their peers, the same way. We not expect anything different. We not expect anything different. In short, for us within this community, we the advocates say the same way they treat the other children. Treats the children when get special needs the same way. You go market, buy clothes for everybody. Buy clothes for them. Himself now, human being. You get emotions. You cook food. The same food you go serve them. Now the concern now, maybe from this person perspective now, what if this pikin na picky eater? They tolerate this kind of food, they like eat this kind of food, they select food, they agree. Or in addition to maybe the child being say the pikin na picky eater, maybe the waiting the discussion of mind follow be say this particular pikin no sabi feed himself.
Yes.
Everywhere go
Again, my mind
scatter. Now make we start from the second one. See, e get skills wey typically developing people like you and me they learn just by observation. Say they see other people do am. Say okay, to come this studio, everybody they waka this road. Even if your mind they tell you follow another road, you go take make I no look like odd person. Make I follow where everybody they follow. Nobody tell you may you follow that road. You just they observe everybody they follow. You might follow them. Feeding, typically developing pikin, you go from small self. From finger eating, you go just put in food, give and go use hand. Eventually, you go say no, make put for your hand. The same way. In short, the pikin self, as in they see on they use spoon, in go carry spoon by himself. One follow user. Now for other children, for make I use pikin with autism first. Or cerebral palsy, where affect cerebral palsy na condition where they affect motor coordination.
The muscle.
It affect motor. So children like this, maybe they no fit control certain parts of their limbs, maybe hand, maybe leg, depending on the severity or the type of the cerebral palsy. What we go do in that case? Now say we go teach. That's not the purpose of intervention and therapy. Therapy and intervention, they in place so that we go fit help this individual attain independence as much as possible. Now why for the beginning we dey start with very functional skills where everybody supposed learn. Potty training, you go fit brushing teeth, you go fit comb hair, you go fit wearing clothes by himself, because as the person they grow, these things they become more complicated. Say you dey bath adults, you dey dress adults, you want brush adult it. What if you no one brush and I go fight with that? So you go start when it is small. Make I use personal experience. You get one client when I be meet. He may be 6 years old by the time when I meet her. And at age 6, he may they use hand chop everything. Whether I want chop rice or beans or chips or anything, na hand they go use chop them. As I meet the family, part of the, in short, the first set of goals will be set, because at the time he been not potty trained. We've been put potty training, put that improve feeding skills, then dressing. Now the first major goals we've been working on, in addition to behavior modification. Now, I been go back to waiting. We go consider odd. Say you not supposed to hold small picking hand. They carry food. They or when they use that hand, they chop. If frustration too much, if the food they pour, he go throw it the spoon, drop hand. We went through all of that. Go hold the hand. Initially, he go scoop the food. He go come the struggle on how to carry the food go mouth. Maybe the whole thing go pour. But you go encourage, you go celebrate every little adjustment. Even if he scoop full spoon, then waiting come enter a mouth and like 3 grains, you go celebrate them. You go start from hand over hand. You go hold the hand. Yes, hold them. Help and scoop them. Carry and go mouth. Put her inside, then you go praise her and say you don't even do that one. Eventually you go begin from holding the hand, you go just they touch the hand. Tell her, oh yeah, encourage her. Then you go carry her. Put no fear, say you go make mess, you go dirty. If baby they chop, you go dirty everywhere. Yes. But no problem. And just like what you talk, ma, this thing no be responsibility of only therapists. Therapists feed day how many hours?
1 hour.
How many times? How many times that pikin won't feed within that period with therapist day? So you, the parents and the pikin siblings, must follow the inside. So you see, say to teach pikin to use cutlery, take chop, to use spoon, to use fork, take chop. That's something where you fit teach. Make it be say because of the condition, maybe the coordination no dey the hand. Then we will say, oh, now because of this. But even at that, if you consider if the other hand, even if not left, they work fine, you go teach them to use left to chop. You go teach them. Then make we go the picky eating side. Picky eating, plenty things fit cause am. Some if it be sensory, they no like the texture of the food. You get some children will be say not only crunchy food they fit tolerate. So even if you dey fry chips or plantain, you must fry and make dry well so that as they bite again do crack. For some other people, not only food where they puree.
Like ice cream.
Puree. So yes, and the best thing I say make you start them early.
Not true.
Because the longer you keep them, they postpone. You just they postpone judgment day.
Not true.
Because the picking will come. They too used to this particular way. It go come hard to change. So from small, introduce them to different. They no like them. They introduce small. Maybe you give them the one way they like. Or you tell them say, just take one. Take
like
one.
children,
Then you go come and take this one where you like.
Exactly.
Small.
So use one reinforce the other
Exactly.
one.
Exactly.
That's so.
So what did I go out to Oga in the room say? As you talk just now, say now only 1 hour, maximum 1 hour 30 minutes. Now therapists go stay with family. Not true. So for parents now, for that kind of picky way person to teach something, now go the great opportunity for the picky to do one plenty time. Definitely that kind of picky no go fit eat plenty food once.
That's true.
So even if na picky will like to eat plenty food once, because now the trainer for something now, una go dey divide the food many times across the day, so that he go during the day he go practice with the cutlery plenty times. So that one will be say as therapists they do work, family member make una dey dig there. Not be say una go leave therapist with una pikin, una go just enter house go dey do una own. Therapist don come, na im work be that. Therapist go after 1 hour 30 minutes. Una dey follow up with therapy. Una dey know wetin therapist dey do for una pikin. Then una dey practice am with una pikin, because na that practice na the pikin go take perfect time.
No, thank you very much for the answers. So as them talk, practice again and consistency. As Mr. Aini said just now, he say make we start early. So make we introduce this food small. If you try to get within you like, make you use that one. They bribe them. I bring Mr. Aini.
They reinforce them.
Na bribe.
You know this thing when you talk now, small difference there. Bribe na say you give am the thing before you do wetin you tell am make you do. But reinforcement that after you don't do wetin you tell am make you do, you can't give am.
Better bribe. It's not reinforcement. Okay, no problem. The next question. This one a very interesting question. So this person asks, say, what be the difference between autism and the deaf and dumb? They won't understand the difference between these disabilities.
Okay. I understand the difference between autism and deaf and dumb. Okay. So I will begin with I go reframe that question small. Make the question I should say they listen. Might not verse. So I go reframe the question small. You know, say around these climbs, now our work and everybody work, including on our way they listen, to correct certain language
yes.
we not they help anybody. Now nothing they like say you say person they deaf and dumb. Nobody they deaf and dumb. So is it that person they deaf or person they non-speaking? In short, dumb self.
It's very wrong.
Now very wrong terminology. Now people when they deaf, some depending on when their hearing impairment starts.
Yes.
Fit sabi talk or no sabi talk.
Yes, that's right.
Person wey become deaf later, maybe they work for factory, maybe blast or they war prone zone, something goes spoil in hearing. Maybe when he don't grow, he don't already sabi talk and everything. Even on top saying they deaf, he go still they talk.
That's true. I don't see them.
But person wey born, maybe say as him born, he born like that, he not the hear. Now that case most times we be say he never acquire language yet. So he go dey different. But if not that, you go see saying go they make some kind sound when in the sign. Because now sign language now be alternative language where they go they use communicate. So deaf and dumb na wrong terminology. Because my people.
And
Now,
the correct one now
deaf.
Visually visually impaired.
Yes, or hearing impaired.
Hearing impaired. Hearing impaired.
Hearing impaired.
For eyes, now be visually impaired.
Exactly. So now, difference between hearing impaired or deaf person with autism, it is very broad.
Long.
That road far where. But make I help the yes.
People do it be say they're deaf and they get autism.
Yes, of course.
We go touch that one as they go. Now, person when you get autism, autism na condition on its own where they as a result of say the person brain they wired differently. Yes, and autism na condition where they affect 3 areas. It they affect behavior. Maybe say you go they see the person they manifest some kind of behaviors where they different. Maybe you go they do one thing repeatedly. If they sing, you go they sing the whole day non-stop. If they hum, you go they hum, you know go stop. Or maybe the person go one day flapping hand or they play with him fingers one kind, or that repetitive behavior you go see him, or the person go they interested in one particular thing. Now only that thing he want to do. Maybe he like one particular cloth. If he want to wear only that cloth or only that same color of cloth, restricted interest. Then autism they affect social interaction. So people when you get autism, the same way me and you they socialize, they associate with people. If I look you now, smile, you might go they look you say okay, at least this one na person where I know you go smile back. If stranger look you smile, you go look at one kind first say but or maybe one day rude, you go smile small, make you no be like say you dey fall the person hand. You dey mirror social interaction. Normally humans nobody be island. We want day around other people. We want if children they play, even if that pikin never entered that environment before, once he enter that place, see other children they play, fiam, you don't run, go there, me go join the play. But children when you get autism, sometimes then go prefer to dey by themselves. They no one join waiting other people they do. So then that social withdrawal they dey sometimes. And another area where autism they affect na communication. Some of them they fit talk the same way me and you they talk. Some their words they very few, maybe one word, one sentence, and they fit decide maybe they no use the word. Then some no go even talk, no they talk. So you see, I don't talk autism now. Deaf. Hearing impairment, na say person not the hear, na the only thing with that. So you see the difference. Difference there.
Difference there. Very clear difference. So as the correction way Mr. Ini make now, he say na hearing impaired, hearing impaired, which be deaf, and then speech impaired. So I beg, I no use dumb again. I beg. Only we get anything to add?
The only thing that I will add is say autism, as again you talk just now, autism different well from hearing impairment. But the thing be say some children they say they get autism and they see they hearing impaired. So now that one make them be say, maybe we are not the judge people. Maybe we are not the talk say now because the papa and mama not discipline. Because the pikin way they say they're not disciplined. Maybe the pikin never even hear anything well okay? On top of that one, you can't get autism. Just this one pikin. So the papa and mama go they struggle on how to reach this pikin. Maybe papa and mama not even sabi speak, they not sabi sign language. Because children person when himself not get hearing impairment. If you both pikin will get hearing impairment.
Yes.
Very true.
And that pikin because they carry condition like autism, follow hearing impairment come. Then you go there, they talk say they're not trained and well. So if you don't know what they happen for people life, maybe waka.
I'm telling you, many people need to waka for this life. They talk too much, honestly. So this next question now concerning school and inclusion. So the question say, as we want change, as we change curriculum to aid inclusive learning for school, how we fit ensure say the children wey we dey call regular students now, they feel included and not secluded from the whole system. Let me say, I think person want to say so that in a way that these people don't feel like maybe they are not special rich. You understand? You say children, they get funny way of interpreting decisions and behavior. So if you're not careful, you go be like say, they favor this speaking, they don't favor us. You understand? So how we fit carry everybody along. We say everybody can understand, say this inclusion not be for only the children, maybe say they need this additional help, but them too feel benefit from inside.
Okay, make I start. Okay,
No, please, I beg you. I beg start.
Okay, first of all, the person will ask this question, and all of the adults who did this world. Now will be the problem where both the regular and the especially children, the adults, now will be their problem. Because children are children. If we not separate things, we not show them with everything. Say this one better pass this one. They not see anything way better pass anything. They just want play and they go play with everybody.
Everybody.
Make I tell you now what I experienced day before yesterday. I go one special school. I don't they go this special school. That school they get reading clinic. That reading clinic now for children will be say they did regular school, but they behind because they get problem for reading and writing. So they come this special school, they get extra support because they get reading clinic for them. So this small girl, 2 days ago when I go to special school, she entered the class of the children will be special need. She go push them come out from class. She go push them with their wheelchair come out. When the girl push the first speaking come out, I look the girl where we want make sure say not be this girl when I see for inside office just now where they do reading session with this. Because her uniform different. Now her school uniform now she wear come for the extra classes. She not be student for this special school. She push the first speaking, she push and go outside. With joy, love, happiness. Then she go back again, go push the another picking. Now go meet the teacher, the reading teacher say what I see you. I say, children, they don't get negativity from her.
At all. Very
now
pure.
we will be adults, now it be their problem.
They teach
I
them.
say, you see this speaking where you just teach finish, so you know what they do? You say, what you do? I say, this speaking go inside class just now. She go push wheelchair of 2 of the children where they that class where they use wheelchair. She go because school won't close. She go push them come out. She said, really? I said, yeah. So both of us go they discuss about this. I said, you see, this is an inclusion now. If you say this girl not come to school now, she not go know what it be to sit down for inside wheelchair. At least at a close level like that. She they finish her remedial class now, go they play with her friends we get disability. Not only play with them now, she they help them. So how you want to tell that girl tomorrow now say these people they be witch, they be wizard, they be this, they be that. Do you understand? So the adults, now the way we talk about the children with the condition for class, now the ones where not get condition but they understand.
True.
That's true.
If we dey in the presence of those ones where we say they're well, we dey treat these ones where get condition like rag. These ones, but now they destroy the one when I say it well. Because that one go they feel like say it better pass this one.
Yeah.
Now so you go feel so the small one where you know all go lost.
True.
Then your behavior problem will come start. That one will come another problem to solve again. So in all of these, now the adults, because by the time we they over explain things, we they make too much big thing out of them.
Our explanation.
They be human being, period. They need your support. You self, you need their support because the more you treat them as human beings, the better you become
As a human being.
So if we make the teaching and learning environment normal, no pikin go feel left behind. And on top of that one, because they encourage peer support, which means say those ones where we feel say they're strong, both for the children where get the conditions and what we not get, there will be group leaders, team leaders. So if the person will get cerebral palsy, for example, will get Down syndrome, autism, now fantastic artist. It's a bit draw away. During drawing class, now you go be team leader. Now you go coordinate everything for your team because now what is sabi be that. Then the regular pikin will sabi English where. Now you go be team leader during English class so that you go fit support the dyslexic students.
Yes, we know if you understand.
Or the ADHD, we know if you focus. So as soon as they engage them for each other business, they go to see the need and the benefits of being their brother's keeper.
True.
Problem not there at all except the one where the adults where they this word they cause.
True.
That's what means now what me I say for instance with that.
Ma, you don't, as in, you know, get waiting they won't talk during this one. Because if we get this kind of inclusive environment, now everybody they benefit.
Everybody now they benefit.
Both the children will get disability, the children will not get.
Exactly.
And the thing now be see, for the children where they don't already teach you it's not good. Now the teachers now, this school, you go fix
that idea.
Yes, you go gather.
With your own behavior, number one.
Thank you.
Not be with your mouth. You take your mouth, they talk, you do another thing.
Exactly. This now conversation where we no need the shy about. We go need address them.
Yes.
We go need teach the other children say, okay, see this person. This person they different from you. You know they less.
You know they less. Difference, not be
It
less.
just they different, and this na the accommodations. This na how you fit take support them. This na how you fit take, and they go carry and grow.
Yes, children go learn and they go support them. As we dey talk this our talk, I just remember that our students from now open doors during that our event, that our small girl, which they coordinate the other students.
No,
we
from
get
Otana.
From
Hearing
Otana.
impairment.
Very good. The exact example way they give.
Yes.
This small girl, and she turned their leader. If you see her, they coordinate them, they organize them, they interpret for everybody. You know, very, very quick and proactive. And because they include them, you know, they add them and they engage the two of them. She feels talk. She feels talk.
Exactly.
But she they use sign language. She interprets for these children, interprets for us, and very, very beautiful to watch. Honestly, very, very beautiful to watch.
You know this thing when you talk. When I did do my master's program,
Yes.
I been get colleagues when get hearing impairments. And sadly, I no go mention the name of the school. Provision been no day for sign language interpreter. So lecturers go come, then go teach, then go talk, copy notes they go.
You don't even bother about this. This
Now me, we be fellow classmates. Now me be the interpret, give
them.
my colleagues with the hearing impairments.
Yeah.
And if you imagine say maybe something happen because I mean they work, they do that program. Maybe something happen, I
You
no
no
come
come
lecture
class,
that.
You don't finish with that.
They no go learn.
Or maybe I come, I don't tire. Some days my eye go dey turn, but I no go fit just lock up say, "Kai, my classmates they know they benefit from wetin they talk." I just need, but you see when they talk about inclusion means say you go need put these things available for the environment.
You see what I talk about adult problem just.
You
go
go
lecture. You don't remember again say people when they teach some of them
No, they hear. Now, wow. So how you want to expect those women to write
He
them?
go copy,
Copy
he
them
go
fast.
copy notes. He go copy note or you go
What
photocopy
about the
notes. Give her.
small things when no
Thank
go
you.
there
We
inside
no
notes?
dey inside notes. Where you
That's
go
why you dey
explain.
go in school.
And that's so now. You see, they don't refresh. Now that they go just continue the same process. And so. Now, thank you. So we get, I think we get two more questions or 3 more questions. This question be saying, how do you teach or handle children here, like we want me to, with multiple disabilities? If say one pikin gets, if he get autism and cerebral palsy, or if he get autism, ADHD, if you get autism and dyslexia. So how you say you will feel manage these children? Maybe say you feel get your potential and improvement because they have 2 different issues now.
No, it depends on the condition.
Okay.
Many therapists go support different conditions.
Yes.
This sign language now, that make for me, I believe say sign language supposed to be language where everybody they learn from primary school go to university.
I agree.
Because na language. So if sign language na language where everybody get access to, everybody fit speak. The amount of problem we don't solve for our society not be small. Before pikin we get autism and dyslexia with we cause to be non-verbal because no fit talk. Huh? You go just start to sign language with that.
Not true.
So I don't get a means of communication. The neighbors, they speak sign language, at least maybe 1 or 2 persons for their family. Una go communicate. So
It go easy.
Exactly. That is why sign language must be an established language for our country. Because we get people with disability for this country. And not be only people we know they hear any sign language.
Yes, sir.
People with intellectual disability like autism, or people will be say autism we know they talk. And even people will be say they don't get autism, but they not just they talk. Get speech delay or speech issue. Sign language now even a way of motivating them.
Yes.
Onto that speech, because you go to give them confidence.
Exactly.
Because as they sign now, you go to use the word.
Exactly. Also reduce the aggression.
You go to use the aggression because a means of communication. So if the kid get autism now, get dyslexia with non-verbal, sign language don't solve plenty problem for him.
Honestly.
Then ABA, now behavior, this thing. ABA,
therapy.
what be behavior? Behavior, now everything we do. You dey eat na behavior, you dey talk na behavior, you dey sleep na behavior. So ABA now one therapy wey go solve everything for anything as long as it's properly applied. With patience, perseverance, and the right approach.
Yeah.
The right approach, very important. This right approach.
The right, correct approach. Not be say make I do as make I do for this pikin as I do for that pikin. No. Every pikin different. You know they say, I don't tire. If you tire, not do. Go house. You know say you tire. Be at alert, know what you are doing, be focused, be intentional, and follow your assessments. Just like medical doctor, you know, go just prescribe medicine.
That's true.
You go to observe, you go to follow the result of what you don't do. Now that one now you go to follow.
Now so it be. What I need add. This person they ask how you fit take support person we get different forms of disabilities. Now the way we they approach interventions and therapy. Both as special educators and practice-specific therapists, you will start with to diagnose the conditions. You could do assessments, which waiting be the challenges of this speaking. Once you don't feel established, say, okay, this speaking get ADHD, get attention issues. This speaking follow get learning disability. After you don't run the assessment, identify waiting they happen. You and everybody inside the team, the parents who, if the pikin don't day of age, the pikin go follow the day. The regular classroom teacher, the school administrator, if the pikin gets speech therapist, you go bring them. Everybody go sit down. We go now decide, say, in the next 1 year, in the next 6 months, waiting won't teach this pikin. Yes, regardless of which kind of disability the pikin get. Once you don't establish, maybe set goals, pick 4, 5 goals, write and down. Now based on that goals now you go begin apply strategies. We go help the child overcome the challenges when he get as much as possible. And that meeting, that goal setting process, that waiting they call IEP. IEP now waiting they use for every pikin when get special need, regardless of the type of special need where he gets or not and level. So if person say they do intervention, they do therapy, and never discuss goals and IEP, hi, problem they there.
You know, you do your work well
because you suppose they work from document. Nobody say you go just they do everything way pop up. At the end of the day, you feel they do too much and you know they do anything.
That's true.
So you go decide, say at this point, like the example when I give that boy when I meet, instead they very primal level that point. You see they wear diapers at 6 years. They pee, they put inside the, you know if you wearing clothes, they dress them. They feeding, you go they give out, you go they scoop put for a mouth, or you go use hand, left, right to chop. You know this, you don't want place. You know, so we decide, say, okay, in the next 6 months, one teacher make it pee, make it they ease himself on top potty, on top toilet. You understand? Then we say, okay, in go learn, make we start with shoe and underwear. Make we start there. You see, say we they try push the child towards independence. So depending on the severity, for different children, if you be say, okay, now you don't know how to blend 2 letters. And make we push up and go 3 letters. See as it won't be. Make we add sight words. Make we add maybe 15 sight words. Then for maths now, you don't know how to write the numbers. Okay, make you teach her how to do one digit addition. Make you carry this one, join this one. You see, you go work from goal. As they achieve the goal, you go face those ones, come out, add new goals. Now so the process they be, and you feel support any child regardless of the condition.
That's true. People when I don't hear waiting them talk about the support. So no be say we go use too many different things. We feel support different conditions at the same time.
Yes.
And as strategy we go use. Before the next questions, our Dr. Bako they online, they watch us. So Dr. Bako say as they talk am for this place every time we say you know they hear or you know fit talk, no mean say your brain no they work.
Exactly.
So make una no forget the brain is still very functioning.
Yes.
We get hearing impairment and speech impairment. No be say person no fit do anything with his life. Tobacco say things plenty for ground this week.
Yeah.
So by next week going forward,
you go full ground.
God bless them.
Amen. Thank you.
So our next question now a continuous question from you, so that's why I paired them together.
Okay.
The question say how teacher will fit teach maybe the teacher gets 5, 6, 7 or even 8 students. We get different disabilities for the same class. Now how you go fit approach them, how you go fit teach them and ensure that everybody gets the right needed attention and support. Yes.
This one a master class. Who go organize?
Selection of master class.
These people, some people not like affair.
And I go sit down for hours for this one.
This one I don't know they pay for. Some free. Free small.
You go help us summarize.
As good person when I be. No. The small I go talk based on say we be good people, so we go talk small. Now inside special education, different approaches there to take handle classes and the rest. You get what they call ability grouping.
Okay.
So based on severity and the closeness of the goals and everything, you go fit group children wey fit do certain things at certain level for one group, children wey they struggle more for another group, so that chunking go help you know how to pass the information. Ability grouping go, it means say pikin wey fit do multiplication no go dey the same place with pikin wey be say na only to count the numbers.
Now you know.
So you go sort them based on skill level, severity level of their condition, and how they feel benefit. Wetin be education? At the end of the day, the target now say the pikin don't learn, may go house. No be say you carry pack children put for class where they should come every day. At the end of the day, you know fit tell whether you don't help the pikin or you never help them.
Because you say frustration won't kill you.
Yeah.
Everything they have for at the same time.
And for children we get more severe presentations, you go learn say sometimes not be only one teacher go fit work with all the children.
Okay.
Sometimes depending on how severe it is, some children go need maybe 3 to 1, maybe 2 to 1, maybe 5 to 1, sometimes even 1 to 1. Depending on how it takes severe reach, you understand. So all these things now waiting you go learn for the master class we go communicate future dates. Yeah, but basically now so you be ability grouping now waiting I want make on a carry go house.
Not maybe class different, not maybe differentiation.
No, ability is different from differentiated instruction. It different small.
Okay. So what if differentiated instruction not go fit play any role?
Definitely, it go play role. It go play role. Now, differentiated instruction, we say you don't know all the children when they inside the class. Now, we they bring tips from the master class where they invite us. Differentiated instruction that say you get children with different abilities inside the same classroom. But because you don't do assessment, no say, oh, now see the way this pikin they learn. This pikin, they learn fast when they see something, maybe from video or another one now when in they using hand they do the thing, they manipulate the thing. he go work for this pikin, another pikin just make you dey talk am, he go come inside. Now as you dey teach, as you even dey plan the instruction, you dey think of each of the learners wey you get inside class.
That's
so you
true.
go tailor the instruction in such a way that every child when dey inside the class go benefit. A wider you see I go call it now a wider
Approach.
school of thought, a wider approach. Now they don't lump them under universal design for learning, UDL. You see all these other strategies come dey under the UDL, so that despite or regardless of which condition the pikin
Yes,
gets,
even regular children.
Yes.
he go fit still benefit.
benefit.
Say
Especially
that-
that,
End of the day, that inclusion still dey take place.
Yeah.
With the whole differential
Yes.
learning
Exactly.
and ability
Grouping now.
That's okay.
No, finish.
That ability grouping make me remember when we did secondary school. One thing wey our school can do for math class, you see say some students, some of us we dey behind, some of us we dey middle. Some students they don't go far,
Yeah.
so they can divide the class into three with
Yeah.
3 different teachers. So one teacher they know their class. Students where they far, they know they sit down, they explain. They just solve. They go. We wasted the middle. They go explain and all of those step by step homework. They say they down. They go take them slow. We go all do the same exam.
Yeah.
But the point be say so that everybody go understand.
Exactly. Exactly.
Something like that.
Yeah.
So for all of this one we dey talk so now, school administrators they get plenty work for them. Because teachers do training, they learn, they do all. They need the permission and the support of
Administration.
school admin so that they go fit apply everything wey they go learn or everything wey they know. Because sometimes
Sure.
school administrators na they stand. Na they
Must
na
be
they-
this
na they-
way.
Yes, na they because for them na expenses na they calculate. But may we not forget say if these children wey dem dey these schools na dey be the reason why you go make money in the first place.
Sure.
And the more you produce pikin wey really fit show say papa and mama pay school fees, they wake up every morning comot for house go school, and e really come out the way wey suppose to come out, at least within the expectation, your school no go empty, e go dey full. But if we cut corners, we fit make that profit for the first 2 years, but after the school will go down like this. Then another thing be say school administrator for everything wey we dey talk so now, I hope so that they see the benefit of when the higher special educators for our school.
Na
In
must.
fact, school administrators they lose out from
Very important.
money where they come from special needs side. And not be small money, because families want make other children go the same school.
That's true.
So if you can't get resource person for your school, special educator, where if they manage their picking way slow past the rest, why they go change? Why they go carry and go to that school? Because over time it go improve, and it go dey cope with the brothers and sisters. And not be only to read and write children they learn first, but learn character. How picking go take learn character if everybody wey dey class all of them are the same? They don't go see anybody where they go say this person you need help, make a help her. Because all of them fit do what they need to do now.
Yes.
How did they learn character? They learn character because they make effort.
Yeah.
If all of them now be genius for class, which kind of character na go learn? I'm not going to learn anything now. Now let that book now go do in her head, but you're not going to learn how to take support your fellow human beings. And that one I have to add.
Well, thank you very much for the answers. We get one more question, then we get the last question are for Mr. Bako specifically. Mr. Bako, I make I remind you, I
Dr.
beg.
Bako.
Hey, Dr. Bako. No vex. It's not Dr. Bako. Make I give respect to who respect is due. Dr. Bako, you get specific question after this our last question. So the person asked, say, why we say children will get autism, they bring out saliva from their mouth sometimes. I don't know whether now autism or cerebral palsy they want ask of, but
You know, say part of the responsibility of this podcast now to educate people.
yes.
So it dey okay. Bring waiting you know. We will help you arrange am.
Yes.
We'll tell you the appropriate way it be. Now, earlier on today, I explained waiting autism be the areas where they affect. Say they affect communication, behavior, and social interaction. Now autism be that. So any other thing we follow, most times no be autism. Although if it coexist with autism, but no be autism. Now, wetin dey make people comot saliva for mouth? Na poor muscle control, poor muscle coordination. So if you imagine say you now, if you want to raise your hand, because say the muscle to muscle coordination, your brain go just send signal, you go raise the hand. Now you get people wey be say they want raise their hand, but because of the muscle coordination, the brain don't send the information, but make the hand follow the information. You come hard. Make I use one instance. You get one fine small girl yesterday. You want pick ball, then keep the ball on top one shelf. She get cerebral palsy. You want carry the ball. He go there, he move small. He try make it coordinate the muscle, make coordinate the hand, make carry the ball. She do, then carry the ball eventually. Another pikin will get proper muscle control. Go down, carry the ball, they move since. Now that same muscle control will they help make person feel move hand. Now the same muscle control will go help person, will go where they help with communication with speech. You get some people when get slurred speech and the rest, or the coordination or the coordination of the lips. They won't close their mouths normally, but because of the poor muscle coordination, the mouth now feel they hang one kind, and now waiting they lead to that drooling. Because you know if you keep them together, some people even get swallowing difficulties, and due to that swallowing difficulties, if saliva too much for your mouth, you go swallow now. Yes. But for some people, due to the issues with that coordination, the saliva will come gather, and maybe say you don't gather, then the mouth no feel close where you go begin come out small. So now waiting they cause drooling with that. But different strategies there to take support children with the drool, and beyond strategies self. If you follow teach some of these children, some of these individuals, if they use hold their own hand towel or piece of cloth, when you don't they come, then go clean them, so that you know go come be problem. For social settings. So drooling no be something we be part of autism. Most times now children when you get cerebral palsy, because cerebral palsy na the condition where they affect muscles. Or person where just they recover, or we get even adults we get stroke, or we suffer stroke or something like that.
Yes, they could
that because muscle control don't the weak for one part of the body, that part of the body they feel begin drool from that part to the mouth and the rest.
So thank you very much, Mr. Amy.
Yes,
we get guests for our studio. Mr. Boniface, you come early today.
Hey, coach, tell us bye bye.
Mr. Boniface,
I try make I meet up. But
welcome. Thank you very much. Thank you very much. Mr. Boniface, the question where Mr. Ini don't answer now, I be say the person asked why we say children with autism they bring out saliva from their mouths. Mr. Ini don't explain them just now. So if you get anything to help us add.
You see, say some of our children we get autism, they like imitate. they build imitation because it's imitation skill and one of the preverbal skill we get. And sometimes they like see waiting their environment. They like copy. So it could be say the child they copy waiting you see because drooling no day connected to autism. Now children will get musculoskeletal cerebral palsy, them stroke them, and then they get issue with drooling.
Hey, children. And then they get autism, when they don't get autism, they still be children.
at the end of the day.
Thank you very much, Mr. Boniface. So our final question to Dr. Bako. In fact, the person said, Dr. Neurologist. So he started the question. He said, Dr. Neurologist. He said, very quickly, if he highlights the subject, we go enable study for secondary school so that he feel be neurologist as well.
Oh, I see.
So we have an aspiring neurologist.
I do.
Dr. Bako
na mentor now.
So I beg, give us type our answer so that we go put out for the platform.
So
Make the students see.
The person student
You
go
don't
see
get
the answer.
partner number
You
3.
don't
You
get
know
partner-
say na MC
MC
you partner
Young,
number
number
2. So now you don't get partner number
MC
3.
Young join. Young na shakarani.
Now one day you know like this.
I want to
People,
Yeah.
now thank you. Now do well this afternoon.
Yes,
So we don't answer all the questions.
Yes, sir.
We don't get questions. We
Try.
don't answer everything. So all the questions where they give us, both the one for the conference and after the conference, we don't answer everything. So now do well. Our mommy, Mr. Ini and Mr. Boniface.
Yes,
You
sir.
do well.
Yes, sir.
You don't come quick, but you do well.
I beg you, I don't know.
So by this time again, next week, we go our program. Hopefully we not go get any interruptions. So we go hold our program as usual, every Saturday. I hope say una don't learn. I hope say those of una wey ask this question, una tune into today's segment so that una go get the answer to una question. And follow up, I fit ask more questions for the chat, and as we dey go during more question and answer episodes, we go dey answer the questions.
Yes, sir.
At the end of the day, we want to make everybody get as much information as possible, because biggest issue we get for this community na ignorance. The ignorance is too much. So everybody just they do wetin they think say they right, or they feel say na be the correct thing. Half of information is too plenty. So at least may we get educated. So with that, I get into my say me I don't say goodbye.
No, we not get into just to say our people. Una do well, so una join us today. God bless you now. Make we meet again next week.
Better people, and I thank you well. And now so the be now. Next week go sup. You go make sense past this one.
By God's
Oh yeah,
grace.
nah. Mona day well.
Our people, I dey greet una again, especially. Especially, I thank una for tuning in. And they ask make una always bring another person. Not just come alone, sit down.
Yes.
Listen. Bring another person, because if we dey do this thing together, our voice go large, it go make sense.
Go large,
So
yes.
same time, same venue, I remain Oga.
Oga Bobby. Who want take that title from me?
I beg make una no forget to subscribe for this YouTube channel, and make una follow us on our Facebook and our Instagram at Modupe Afiz Ogun Foundation. Make una follow so that we get updates, regular updates of events where we dey hold, and podcast sessions and any other information where we dey pass, because at the end of the day, many informations they come to social media platforms, especially that our Facebook. I think say this past week we post how many things this week now. And so this month now month for the many special conditions. So information is plenty this month. I better make una follow the Facebook page so now go get educated and enlightened. Now do well, now well done. Thank you very much.
Bye bye.
Bye bye.